Hi, I'm Victoria, and I'm going to be your nurse today. I'm here to give you your morning medications. Could you state your name and date of birth for me? And are you having any pain today from 0 to 10? A 6? Okay, so I'm here to give you your morning medications. First up, we've got your Percocet or oxycodone and acetaminophen. And this medication is appropriate for this patient since he rated his pain as a 6. They're also on multiple other medications to treat their hypertension, so I would make sure to check their blood pressure prior to giving, since this medication can lower the blood pressure. It can also cause respiratory depression, so I would make sure to assess the patient's breathing and oxygenation status. So next up, we've got your metoprolol tartrate or low pressor, and this one's a beta blocker for your high blood pressure or hypertension. So before giving this one, I'm going to check your vitals, make sure your blood pressure is not too low, your systolic isn't below 90, or if your heart rate's below 50. And so if the patient's also taking digoxin or diphenhydramine, I would not give this medication. I would also hold this medication if the patient is experiencing any second or third degree heart blocks, and I would monitor for effectiveness by noticing a consistent decrease in the blood pressure. All right, so your next medication is lisinopril or Zestril, which is an ACE inhibitor. It is also an antihypertensive medication. So before giving this to this patient, I would make sure to take vitals, and I would hold this medication if their systolic blood pressure was below 90. I would also check if the patient has any dizziness, perspiration, or any signs of hypotension. And this medication would be effective if I notice a consistent decrease in the blood pressure. All right, so the next medication is going to be your doscusate sodium or your Colase, which is your stool softener. Are you going to want your stool softener today? Yes? Okay. So for this patient, it is given due to the constipation from the oxycodone, acetaminophen. Before giving, I would ask them when their last bowel movement was, and I would determine its effectiveness if my patient has a bowel movement within the next 1 to 3 days. I would tell my patient to notify your physician if you have any rectal bleeding, nausea, vomiting, or cramping. I would make sure this patient takes this medication with a full glass of water and tell them to increase their fluid intake. All right, so those are all your pills, and I'm going to give you a cup of water to take those. Next, I'm going to give you your heparin shot. So your heparin or Lovenox shot is an anticoagulant to make sure your blood doesn't clot. And before giving this one, I'd make sure to check the patient's most recent labs. So their APTT, platelets, hemoglobin, and renal function. I'm going to also monitor the site for any irritation or redness. And I would determine this medication is effective if there is decreased coagulation and the APTT, platelets, hemoglobin, and renal function are all within normal limits. So lastly, I've got your pantoprazole or your Protonix, and this one I'm giving through your IV. So it's a PPI. My patient has GERD, and this is a proper medication for it. So before giving, I would monitor their vitals, respiratory rate, effort, and depth. I would make sure the patient, I would monitor their site for any redness or swelling, and I would determine it is effective when there are less acid secretions coming back up and less symptoms of GERD.